So let's talk tennis elbow, or some call it lateral epicondylitis. So in my opinion, this is how it starts. It will usually start from a neck injury. Let's say it's my right elbow, or right arm that's hurting in right elbow. It will start typically on the right side, and it could happen from an accident, such as a car accident, or repetitive activities, such as using a computer mouse a lot, or both, a mixture of both. But the effect is progressive or immediate injury to the deep intrinsic spinal muscles on that side, usually at the base of the neck, between C4 and C6 on that side. This causes compression of the two vertebrae and the discs in between. It may cause a slight malrotation and even a backward movement of some of the vertebrae upon each other, which typically causes a straightening effect on the neck or loss of normal curvature at the base of the neck. The next result is that because of the compression, there will be some nerve impairment. Usually the nerve roots will be either partially or completely compressed, but most often it's partial, and it may even be intermittent that can change with body position. The result will be, if it's sensory nerves, you will get pain down the arm. If it's a motor nerve, the effect of the motor nerve impairment will be that the muscles of the forearm will involuntarily shorten, and they'll shorten persistently regardless of what you do to that arm. Now, if you inject Botox in it, you can paralyze it and take the nerve out of the equation, but as soon as the Botox wears off, the nerve will redrive it to be tight again, so that it won't necessarily be a long-term effect. This constant muscle shortening that is there will over time tend to cause a compression over the outer elbow and cause inflammation here and cause what we call lateral epicondylitis, where it's very, very tender. The muscles here, because they're tight, the muscles aren't all functioning, so it will be weak and of course quite painful. Over time, the muscle that comes down the arm that feathers into a tendon will cause traction of the tendon, and that tendon in the sheath, because it's constantly being tightened, will rub on parts of the sheath and swell and cause a tendinitis in many cases. And so when the person moves the arm, they actually will feel the squeaking of the tendon in its sheath. This is all important because it's important to understand how the neck can generate a tennis elbow. Now, if you look at the statistics of rehabilitation, it starts to explain our treatment failures. So if I inject cortisone into the elbow and it's neck generated, then you might expect that there'll be a high failure rate of 75% within a month, that you're getting a freezing / temporary pain relief effect from the cortisone. But once it wears off, the drive to cause inflammation will come right back like a boomerang. It also explains why simple tennis elbow, which is just a little pain and inflammation here, has an average recovery of 1 to 1.5 years, and as much as 25% don't ever really get rid of their tennis elbow. Why? Because they have underlying neck pathology that's driving it to persist. Now you'll say some people do get better with their tennis elbow with injections in their arm. Explain that. The explanation is that you can have the tennis elbow initiated by the neck, so there's a neck injury from repetitive activity or trauma, compression of the neck from the intrinsic spinal muscles, the nerve drives it, or it causes initiation of the muscle shortening, scarring forms in the forearm. This may resolve on its own over time, so the neck may actually recover just because of less injury. The person stops using the computer mouse, they stop washing the car, so the neck actually improves, but the scarring's already formed in the forearm, so that has to be relieved. And so by either injecting just a plain needle or a cortisone needle, which in the studies show that there's not much difference whether I shove a needle in without a drug or with a drug, the results are almost the same. Now, what that means is, if someone has a tennis elbow that doesn't resolve, you want to think about a neck problem generating it. So now, if you start talking about injecting the neck and the arm together, you start to get improvement rates that become dramatic. that's when you start to get very fast recoveries in that tennis elbow, because you're treating the origin and the complication of the original problem. So my general take on tennis elbow, that in generally my position is that it requires both neck and arm therapy, and that's in just the basic tennis elbow. In some of these other pain conditions, there's more of the muscle groups affecting both in the spine and limbs, so they get a little bit more complicated, but I'll explain some of them as well in the coming part of this presentation.